Hello, my name is Andrea Paul, and I'm going to be addressing mental health to prevent juvenile delinquency. This is a topic I am very passionate about because I truly believe that if our children are raised well, then we will have more productive and higher functioning adults in our society. Juvenile delinquency is an important issue to discuss since it can have negative implications for individuals and society. A huge factor with juvenile delinquency is the prevalence of mental health problems or being at risk for developing mental health issues. Kopiak et al. States, as it is currently, most juvenile offenders do not receive mental health care, although studies have shown that increasing mental health care decreases the amount of juvenile crimes committed. The best and easiest way to screen for mental health problems is in schools. This is a reliable place that adolescents go to, and teachers and faculties can sense if a behavior has changed within an adolescent. School psychologists and guidance counselors are the main mental health care providers to adolescents since they are there so often. So supplying and funding for a licensed psychologist in each school will allow for more reliable screenings and a better chance that the individual will get some counseling if needed. Alright, here's an overview of juvenile arrests. It says crimes, but it's arrests. These statistics are from the year 2014 of adolescents aged 10 to 17 years old, and the numbers reported are per 100,000 adolescents in the United States, according to the Office of Juvenile Justice. All of the crimes together are over 3,000 per 100,000 adolescents. Violent crimes make up 157 of those, and they include murder, rape, robbery, and aggravated assault. Property crimes take up 693. These include burglary, larceny theft, motor vehicle theft, and arson. And all the other offenses make up the remaining 407, which include simple assault, vandalism, weapons law violations, drug abuse violations, driving under the influence, liquor law violations, drunkenness, disorderly conduct, curfew and loitering, and running away. One uplifting thing about this is the trend has slowly been decreasing. In 2000, 6,493 arrests were made, 5,998 in 2004, and 5,833 in 2008. However, there's still a lot of work to do to lessen this number completely. Why is juvenile delinquency a problem? Well, it definitely has negative implications for society. A juvenile committing crime affects their family, peers, and society as a whole. Delinquency can result from several factors, such as biological, environmental, or situational. When an adolescent commits crime, their friends and siblings are also likely to commit crime and act as deviants. Mallett explains different risk factors of delinquency and crime that affect society. The first one is experiencing negative life events. These can lead to many behavioral and/or psychological problems. These events can include divorcing parents, low socioeconomic status, or a parent that is delinquent or criminal themselves. There are also neighborhood problems. Living in an area riddled by crime, gangs, graffiti, and much more may model negative and delinquent crime for the individual. The perception of neighborhood problems is associated with conduct disorders. And we have the best friend delinquency theory. This is the biggest predictor of all three for individual delinquency. Peer selection and socialization processes can contribute to delinquency peer affiliations. Adolescents can choose peers that condone their delinquent behavior, or will begin to have more tolerance for delinquency in others in order to keep these friendships. Also, being classified with a learning disability by a public school also had high implications for delinquency. This could be because of the biases and stigmas that still surround mental health issues. And it was found that the strongest characteristic predictor in an individual is the presence of an aggressive disorder. All right, the next problem of delinquency is it is pricey. The Justice Policy Institute estimates that the United States spends $8 to $21 billion each year on imprisonment for adolescents. The average ranges for imprisonment daily of an individual adolescent is from $7.90 to $21.47. These funds take a toll on the adolescent's family and taxpayers, since it's usually not the adolescent that is paying for it. In addition to imprisonment costs, there are also court costs, cost of substance abuse or psychiatric treatments, restitution, or even the potential loss of life. Court systems are faced with the task of rehabilitating juveniles to prevent recidivism, although this does not always include mental health counseling or treatment. Because of these, it is more economical to prevent juveniles from becoming adult criminals. And another problem is there's an increased chance of adult delinquency. Offending during adolescence has shown to be significantly related to offending during childhood. A study performed by Laubacher et al. Studied men from the age of 19 years old that had a history with juvenile crime for 34 years. It found that 68% had been reconvicted of a crime during their adulthood. The study also concluded that the most predictive characteristic of adult crime was characteristics of juvenile delinquency. So going further into the study, found a lot of good things out. Found that characteristics of juvenile delinquency better predicted violent or sexual crimes in adulthood than socioeconomic and psychiatric characteristics. So all in all, the odds of being convicted of a violent offense in adulthood were 2.8 times higher for each violent offense committed during adolescence. Alright, so mental health issues that adolescents can be faced with. Approximately 50% of adolescent mental health illnesses begin by age 14, and 75% are present by age 25. Some of the issues are depression or manic depressive disorders, which out of the adolescents with depression, 64% receive no treatment, 14% receive some treatment, and only 22% receive consistent treatment. Attention Deficit Hyperactivity Disorder, or ADHD. This is the most prevalent diagnosis for those aged 3 to 17. Then we have anxiety, aggressive tendencies, low self-esteem, a myriad of other behavioral problems, eating disorders, autism spectrum disorders, maltreatment victimization, which is physical, sexual, emotional, or psychological abuse or neglect, and suicide, which was the second leading cause of death for adolescents in 2013, according to the Mental Health America website. Approximately 50 to 75% of all adolescents in the criminal justice system meet the criteria for a mental illness, and approximately 40 to 70% of adolescents that have been incarcerated have a mental illness. It has also been studied that adolescents perform poorly in school if there is a behavioral, emotional, or learning disability problem, which can also lead to juvenile delinquency. Adolescents who experience mental health issues without any counseling or treatment are at an increased risk of mental health issues and lower quality of life during adulthood. Some problems that may arise include depressive disorders, alcohol or substance abuse, and/or early pregnancy. Acute or chronic traumas experienced during childhood, and adolescence can have lasting effects throughout adulthood, especially if counseling or treatment were not sought. And again, there are still negative attitudes and stigmas about having mental health issues or receiving treatment for mental health issues. Other factors that can prevent mental health care are lack of money or health insurance, inadequate transportation, or insufficient mental health providers in the area. So a way to combat this is for mental health screenings in schools. Husky et al. Explored two methods for mental health screenings in schools. He found that they are best identified through an organized, brief mental health survey or through identification by school personnel, family members, or other students. There's a small percentage of adolescents that receive care for mental health issues when they are in need of them, but young people are not likely to reveal their feelings of depression, distress, unhappiness, or suicide. Another reason for the school to be an appropriate place for screening is because family members can be unaware of their child's needs for mental health help. Husky et al. Also reported that less than 25% of parents were aware if their child was endangering themselves, and even less were aware of suicidal tendencies. Current policies for screenings. Schools already are required to identify mental or other health issues that may impede learning under the Federal Rehabilitative Act and Individuals with Disabilities Education Improvement Act. However, there are no national standards for screening processes in schools. The American Psychological Association has recorded evidence that interventions from child psychologists, counselors, and other school officials have been effective with lessening the symptoms of the mental health issue. Several organizations have issued recommendations for mental health screenings in schools, as well as stressed the importance of early screenings. The organizations include the Substance Abuse and Mental Health Services Administration, the National Alliance for the Mentally Ill, the Office of Juvenile Justice and Delinquency Prevention, and the American Medical Association. The Office of Juvenile Justice and Delinquency Prevention and the American Medical Association have issued criteria and guidelines for screenings for behavioral and emotional conditions of adolescents. Some other screening policies are the Medicaid Early and Periodic Screening, Diagnosis, and Treatment Law, which is enforced by the National Alliance on Mental Health Illness. This does require states to administer regular mental health screenings to Medicaid-eligible children. The American Academy of Pediatrics and the United States Preventive Task Force also both endorse the position that schools, physicians, and other community leaders be given the tools to properly address mental health or substance abuse issues as early in life as possible. There are some federal initiatives, such as the Safe Schools Healthy Students Program and the Child and Adolescent Service System Program. These initiatives and programs can reduce stigma and biases towards mental health, increase opportunities for preventive services, and allow for the full welfare of the adolescent to be taken care of. So what are some problems when it comes to mental health screenings in schools? For one, there could be a lack of resources in the schools, which could include unavailable rooms to hold screenings, turnover of teachers and other administration, and a shortage of funding for mental health screenings and supplies. There can also be a lack of knowledge. Typically, this would be from the child or the family that do not understand the importance of mental health screenings and do not wish their child to be labeled with a mental illness. And critics of mental health screening in schools see it as an invasion of the adolescent's privacy, as well as an invasion to their entire family's privacy. The current ways of screening in schools violate the requirements for the Individuals with Disabilities Education Improvement Act. This allows parents and adolescents the right to decline any form of mental health screening, as well as any recommendations for further mental health counseling or treatment. My recommendation is to have mandatory mental health screenings across the United States. This would be in the form of a mental health risk assessment in high school for adolescents in grades 10 through 12, and these will be held towards the beginning of the school year. The students deemed at risk or already possessing a mental health issue will be required to have a meeting with the school psychologist once a quarter for continued evaluation and/or counseling. The counseling sessions will be held for approximately 20 minutes during the student's homeroom period. If a student does not feel comfortable leaving the classroom during homeroom for fear that their classmates will know they are going for counseling, visits can also be made before or after school. Reports will also be made to the student's parent or legal guardian, since familial involvement is key when addressing mental health. The risk assessment will be a paper and pen questionnaire. Allowing students to answer questions in this form typically results in more honest answers from them than having a face-to-face assessment performed. Most students identified as being at risk or having a mental health issue stems from a questionnaire or similar screening method rather than from school personnel. They don't like the one-on-one interviews. Beginning screenings in these grade levels will allow for adolescents to understand what mental health disorders are, as well as for an understanding of their own mental health status. It is also a hope that students at this age will trust school personnel, especially the psychologists, to talk about their mental health and be receptive to counseling and/or treatment. The licensed school psychologist will administer assessments and deliver needed counseling and referrals for further treatment that may be needed outside of the school. The psychologist will be supplied through funds that are already allocated for school nurses and guidance counselors. The guidance counselor positions will be cut back to one position per school to ensure they are still available to help students with academic needs while allowing for their mental health needs to be met as well. Since psychologists are stationed at the school, they can monitor adolescents' friendships and address any concerns if they feel the adolescent has any delinquent or criminal friends. This can also hold true for getting to know their family life, their home life, where they live, and address any further concerns with that as well. The biggest part of this recommendation procedure is that parents must consent in writing to have their child screened and take part in psychologist meetings if needed, or the student can consent if they are over the age of 18. If a parent or adult student decline to be screened, the student and parent must attend a seminar on mental health that will include symptoms and warning signs of various mental illnesses. This presentation will supply handouts of resources for the adolescent in case they wish to seek guidance or treatment. It is understandable that some adolescents' cultures interfere with mental health screenings. In this case, their parents, or themselves if over the age of 18, can provide a signed document from their family physician or religious institution protesting that they do not wish to be a part of the screening or psychologist meetings. In this instance, it is still recommended that the student and parent attend a mental health seminar. However, the signed document may exclude them from this as well. Handouts of resources will still be given. So all in all, mental healthiness and stability is the best tool for becoming a positive and productive member of society. Decreasing mental health issues to eliminate juvenile delinquency is the best way to assist adolescents when they are figuring out who they want to become in life. Depression, anxiety, and other behavioral problems can lead to crime and corruption, possibly for a person's entire life. Steps should be taken early in life to prevent delinquency and offer help and assistance with any mental health issue. Thank you.